Good afternoon. Welcome to St. Clair County EMA Daily Briefing. Joined here again with Chairman Mark Kern and also Sam Bierman from the County Health Department. And Sam, we say it every day, it's almost getting to be repetitive. More numbers continue to rise.
More numbers continue to rise. Every day we come in hoping that today will be our last day seeing an increase, and we come in the next day and it seems to still be on the rise. So
when that day comes, when you walk in the door and no numbers, that's going to be the happy day.
That's going to be a good day. Big cause for celebration that day. So as you guys have known in days past, the numbers that we will be giving you for St. Clair County are for St. Clair County residents that have been tested. And as of today, we are at 2,080 that have been tested. We are at 482 positive test results, which is an increase of 28 from yesterday. And that includes both males and females from under 10 years old up to 100s. We are at 1,548 negative test results, with 50 test results still pending. And today we do have some sad news to announce. Today we are reporting 37 deaths, which is an increase of 7 from yesterday, and that includes a female in her 50s, a female in her 70s, a female in her 90s, a male in his 80s, a female in her 100s, and a male in his 90s, all who did have underlying health conditions, and one male in his 80s with no known health conditions. For state totals, we are at 269,867 that have been tested. We are at 52,918 positive test results, which is an increase of 2,563 from yesterday. And for deaths, we are at 2,355, which is an increase of 141 from yesterday. And our condolences go out to the families who have lost loved ones. Hospitalization numbers, and these are for hospitals that are in St. Clair County. We have 51 patients who are admitted due to COVID-related reasons, and 5 of those patients are currently on ventilators. 4 long-term care facilities that are classified as outbreak status, and that is 2 or more residents or staff who either have a COVID positive test result or who have COVID-like symptoms. Brea of Belleville has 12 positive cases and 2 deaths. Colonnade of O'Fallon has 2 positive cases and no deaths. 4 Fountains in Belleville has 51 positive cases and 6 deaths. Memorial Care Center in Belleville has 43 positive cases and 5 deaths. St. Paul's Home in Belleville has 5 cases and no deaths. And Lebanon Care Center in Lebanon has 21 cases and 2 deaths. And I would like to remind everyone that tomorrow, March 1st, the Governor Pritzker's May 1st, sorry. Gosh, I'm going back a month. Tomorrow, May 1st, Governor Pritzker's executive order goes into place for wearing a mask when you are out in public if you cannot maintain the 6 feet of social distance. And we have been asked some questions regarding, well, what if I'm just running to the store and I'm just running down the aisle, but I can't keep 6 feet of distance in between me and someone else that is on the opposite side of the aisle? So our best suggestion is to have a mask with you no matter where you go. Some stores may have a policy in place that to enter their store, you have to be wearing a mask, and they have the right to do so. So always best just to keep a mask with you. That way, if you have to run into a specific store and they have that policy in place, you'll be ready to go. But if they don't and you are able to keep the 6 feet of social distance between you and someone else, it's not necessary, but always good to have one with you just in case. And now I will turn it over to Chairman Kern for his update.
Thanks, Sam. So we've talked about testing. That's the next phase. Testing, tracking, tracing of people who are in contact with people who test positive. Remember to keep that diary. Every day, write down people that you're closer than 6 feet to and people that you spend more than 10 minutes with. Write that down just to jog your memory should you test positive for COVID-19. This morning, Herb Simmons and I spent time at the Jackie Joyner Center in East St. Louis, Illinois. The governor sent down a large contingent of military personnel who are going to be running a new lab that's going to open up Monday is the goal. A new testing site, and their goal is to test 500 or so people. The range is somewhere above 400, to test them a day, to try to get this testing moving so that the numbers keep going up and up and up. It's only through finding out who has it that we're going to be able to kind of get a handle on the situation. But I would say that, we always hear, well, sure, we've got more COVID positives, we're testing more. But really the number that we're monitoring, the number that we think is extremely important, is the people who are in the hospital. That number is the one that we need to monitor, and that number is the one that we need to see is on the decline before we decide that opening up is a good idea. Right now, we continue to have that number fairly consistent. It jumps up and down every day. What we would like is for it to jump down, and get to a low point. At that point, we would be comfortable, and we think the medical professionals would be comfortable with at least loosening things up a bit. But right now, it doesn't appear that that's the case. Tomorrow, we start wearing masks. I was out a bit today. People are wearing masks already. So we want to thank you. Everybody who watches this show, I know, is engaged in trying to stop the spread of COVID-19. Only way we're going to do that is by you taking all of the initiatives that you've been asked to and just staying strong. If the longer we can contain ourselves and wanting to get out and gathering, the better off we're going to be, and this spread is going to cease, and we're going to be able to go back to our normal lives more quickly. I will read the zip codes. I didn't forget today, and have to be reminded by people around me. And there are many increases, and there are 2 new zip codes that we're adding today. So in 62201, we remain at 10. 62203, we have an increase of 3 to 17. In 62204, we have 19, and that is an increase of 3 also. 62205, we remain at 17. 62206, we have an increase of 1 to 42. 62207, we have 26. That is an increase of 1. In 62208, we have 34. That is an increase of 2. In 62220, we have 48. That is an increase of 6. In 62221, we have 38. That is an increase of 3. In 62223, we have 30. That is an increase of 1. In 62226, we have 69. That is an increase of 4. One of the new zip codes we had today is 62232, and we have 6 now announced in 62232. 62239, we remain at 6. 62254, we have 13. That is an increase of 1. 62257, we have 6, and that is the second new zip code. Once again, 62257 has 6. 62258, we have 13. That number remains constant. 62269, we have 42. That is an increase of 2. And 62285, we remain at 6. So 2 new zip codes, a lot of new positives. It just shows it's out there, folks. It's in virtually every zip code. And even if your zip code isn't listed, all that means is you haven't reached that level of 5 yet. Once you do, then you get the 6th, and you get on this list, which we go through and read every day. So thank you all for sheltering in place and wearing your masks and doing all the things we've asked you to do. And so, as we said, testing is now the way we're going to solve this, get through this crisis. Today we're joined by Justin Cox. Justin is the lab manager at HSHS St. Elizabeth's Hospital, and today we're going to talk about testing.
Yes, sir. Yeah, thank you for having me. It's a pleasure to be here.
Thanks for coming in. So let's go through the process. I think, I don't know what the percentage is, but less than 1% of people probably have been tested in the county. Can you talk about, so a person, first of all, they meet the criteria, which is you have symptoms, and St. Elizabeth's criteria may be a little tighter than the state's criteria, but generally we'll just go into it that they meet the criteria. When you come in for a test, tell us what that entails.
So once the patient does meet a certain criteria, we do actually offer to collect the test there at the hospital. So what happens is we actually do a nasal pharyngeal swab. So what that is similar to the flu test. So whenever they take the swab, it's actually a flox swab. It's actually flexible. It actually is using a swab from your nasal pharyngeal cavity, so it's going to go up and back. So I always tell patients when I have to collect one, whether the flu swab or COVID test.
So it's like a long Q-tip.
Yeah, basically, but it's a lot smaller. So typically patients cry or at least tear up. So it's probably not the most pleasant in the world, but then again, it's very quick. And as of right now, our nurses are the ones collecting those swabs.
It doesn't really hurt.
It might took a little bit or sting a little bit, but like I said, it's very quick. Probably less painful than a blood draw.
And do they do each nostril or just one?
Typically just one, just get into that nasal pharyngeal cavity.
So one and done.
One and done and get out of there. Yes, sir.
So then what happens? So now they've got the sample.
Sure, yes, sir.
Go through the process of where is it processed,
Sure.
and how soon does it come back?
So current state, we're very reluctant to have being part of a system with HSHS. Our sister hospital in Springfield, St. John's in Springfield, is currently doing our reference testing for COVID. So we got a nice process kind of streamlined where we have a couple couriers running there daily, and they'll basically take the swab, perform the test in-house up in Springfield, and our turnaround time is usually 2.5 to 3.5 hours. So we're very fortunate to have that capability. When we also kind of have a backup method just in case our volumes go through the roof and maybe we need to have a secondary lab. And the IDPH lab in Carbondale has been very helpful with supplies and research or information as needed. So we're very fortunate to have resources readily available.
So let's talk, because we hear about other tests. So we hear blood tests, saliva test, and then this test with the swab up the nose. So what's the accuracy? Is the test that you do the most accurate test?
Yeah, so I just want to clarify, as of right now, the St. Elizabeth's Hospital does not have the testing capability in-house. So, like I said, when we send the specimens to Springfield, they do have an analyzer called a BD Max. It's a PCR analyzer, polymerase chain reaction analyzer, and the accuracy is typically 99% sensitive. So it's a molecular test. It's very accurate. And like I said, that's using the nasal pharyngeal nose swab, essentially. So,
and that is the preferred test.
as of right now, that is kind of the gold standard. There's been a lot of talk and discussion about the blood test. So, and there's been a lot of talk about point of care testing. So, and you have to be kind of leery with some of the tests because some of the sensitivity or the true positives are sometimes not as accurate as we originally thought. So, they are coming out with test platforms using blood that can detect the antibody piece, which is really good because once a patient is diagnosed with COVID, they recover, they do form like an IgG antibody. So, however, this information is so new, kind of cutting edge, we're not sure what that result means. We're not sure if the IgG is high. Does that mean you will not get it again? Or if we can maybe use your plasma for another patient? So all this information is so new. So I think that's why it's so important to, if you were to get tested, and to use that information for next steps.
So you really don't know what immunity means. It could be immunity for a week,
correct,
for a month,
yes,
or for a year, or maybe for life. And it's such a new virus, ever changing. Do you? I mean, eventually you'll know. But isn't this virus different than it was when it started in China?
Well, see, I'm not really sure because it's not like we can use a lot of that data from other countries. It seems like we're using what we have or doing the best with what we have as of right now. So. It's just kind of hard to determine the next steps until we get all the data to support and make an informed decision.
Do we know where the first case was in the country?
I know it was in St. Clair County. So.
Okay, all right. I'm sorry I shouldn't have thrown a curve like that. It would have been interesting, though, if you had known.
I'm sorry, I do not know.
You could have said something, and we wouldn't have known the difference. So, so tell us about allocation of tests. So, when we were with Senator Belt and Representative Hoffman and Representative Greenwood, and we're standing up the new testing site that's going to be run by the state in East St. Louis. Their goal is 500 tests. Is there an allocation of tests, or there's still a shortage of testing materials that require you to have an allocation?
Yeah, I think that goes back to with COVID-19 being so new. I know the FDA has approved I think about 15 platforms to do testing. So fortunately, some hospitals have these platforms already in-house, and then some of the facilities that don't have the platforms are trying to get the platforms, but when you get the platform, then you need the reagent to run it. So like I said, St. John's is fortunate to get allocations, weekly allocations to perform the testing for HSHS. And so far, our testing, like I said, we do have a backup plan or a surge plan to send our specimens to IDPH and Carbondale if need be.
So we're across the river from St. Louis. St. Louis is holding tight to the stay-at-home order, as is St. Louis County. But the surrounding counties are opening up, and people are starting to get restless. Do you have a recommendation as to is loosening up? Should it be? It's always under consideration, but is this the time to loosen up?
Yeah, I know that's a really hard question to answer, and it's definitely subjective. So honestly, it seems like it's worked really well with social distancing. So, I mean, I know they say the healthcare professionals, first responders are the true heroes, but really it takes a lot for a person to stay at home and kind of do their part. So to me, it's like they're the true heroes that are not out in the public. They're not doing their part. I know, for example, like my wife now, she's basically a stay-at-home teacher. So I know the roles and responsibilities have changed a little bit. So it's just, honestly, if it were me, it just seems like social distancing, doing proper hand hygiene, wearing masks, it seems like those are the correct steps. And I would hate to have the past 4 to 6 weeks of social distancing and doing all these things to just kind of go to the wayside and see a drastic spike. So as of right now, it seems like stuff is working really well. And I honestly, it seems to continue to keep doing what you're doing. So.
And I got to say, you talk about people staying home being heroes. We were talking earlier, you haven't been tested. Now you've had every opportunity to get that test, but you know there's been a shortage of tests, and so we appreciate you just standing firm and saying, I want somebody else to get that test. I don't think I need it right now.
Yeah, and it really goes to patients that are that have the signs and symptoms, or even the colleagues. So I think about like my phlebotomists, lab assistants, med techs, the histotechs, that are being exposed to these patients with positive COVID. So, and then once they get are symptomatic, then those are the people that really need tested. So. And for me, it's like it's not really value-added information. If I were to get the test and be positive, what am I going to do different? I'm still going to wash my hands. I'm still going to keep social distancing. I'll wear my mask when at work. So it seems like that information, even though if I get it, it won't be value-added to me.
But as you say, it's not necessarily about you, it's about others. Sure. And so it's about the phlebotomist and about the doctors. When people, if they're careless and they come down with COVID-19, somebody's going to treat them. And because that person was careless, now the doctor is going to be put into a position where they might be taking COVID-19 home to their families because this other person was careless, and now that doctor is going to treat them and because that's what they do.
Yeah, and it seems like HSHS was very proactive in that approach. So limiting visitors or actually canceling where some patients cannot even have visitors, with the ED having a screening tent to screen those patients so they don't get into the hospital, to expose people that may be immunocompromised or people that are taking care of COVID positive patients. It seemed like the HSHS was ahead of the curve, and administration was supportive the entire time. So I felt like I was very fortunate to be a part of that team.
So just one more question. So beyond COVID-19, St. Elizabeth's is doing other things. So they're protecting, segregating COVID-19 patients, but there's still a lot of medical work going on in your hospital, right?
Yes, sir. So, like I said, it seems like we are busy. I spoke to our lab team, and I think during this entire time, communication is key. It's obviously with everything changing and with multiple meetings throughout the day, it's very refreshing to be in touch with my team daily and have our meetings and relay that pertinent information. But yeah, you're right. We're not just shut down. It's not just a COVID-19 hospital. We do, obviously, they're still delivering babies. They're still taking care of patients that are critically ill. So as unfortunately we can't shut down just for one illness. We are prepared for any type of illness, whether it's COVID related or chronic related or anything. So
And you're prepared for that. There is no cross-contamination that people need to worry about.
right, and that's one of the things. Like, we are prepared for this. We go to school for this. It's like they're highly trained professionals, and our staff is ready.
Justin, thank you.
Thank
Herb
you.
Simmons,
Thank you.
I know you've always got a question.
Always
or
got a
two.
couple of questions.
I thought I was done.
Yeah, he leaves the hard ones for me. Your staff, you talked about them. Is there any other precaution that you've had to take because of this, or is it basically you do the same thing for this as anything else?
So great point. So we do have the same rules in place, I guess the community does. So our frontline colleagues that are in this patient's room they have special PPE, whether it's a cap or mask, or they call them a duckbill. So they do have special PPE when they enter those rooms. However, with our lab, we have multiple colleagues in our lab, and they sometimes will have to be within 6 feet of each other just because of the testing and the way the analyzer is set up, and logistically speaking. So our pathologist, Dr. Hagee, wanted to implement immediately when this first started to every colleague and lab will be wearing a mask. So making sure that we're safe so we can do the testing and perform the procedures whenever we need to. So it seems like we practice that in the lab also.
Good. And the staff, how are they holding up? I mean, have you had that moment where your staff has come and said, look, I'm overwhelmed, or I've got this concern? Have you had any of that yet?
Well, honestly, it does take a mental and physical toll on you, but because they're experiencing their professional and their personal life is being affected by one crisis. So, but honestly, I've never been more proud to be a part of a team, to see people rise to the occasion. Like I said, my phlebotomists are awesome, my lab assistants, my techs, the histotech, cytotech, my pathologist. It's like all those people have rose to the occasion. It's like these are the perfect people to be in this situation. So yeah, they've really done an awesome job.
Well, good. Tell them we really appreciate all the work they do.
I definitely will.
Sometimes the people behind the scene don't get that pat on the back, and we appreciate HSHS and what you guys all do. Thanks
Great.
for coming in today.
Thank you very much.
Thanks,
Thank you.
Justin, very much. So, technology has really done a lot to make this COVID-19 crisis more doable for our government. And today we're joined by Mayor Herb Roach. Herb is the mayor of O'Fallon, as I'm sure all of you know. And technology has really helped to be able to make Herb govern and continue governing during this crisis. Herb, welcome.
Thank you very much, Chairman. Appreciate the opportunity to speak.
Great, Mayor. So why don't you, so City Hall is closed, remains closed, but yet everything still is moving along as usual in O'Fallon.
We were very fortunate. Our team got together early on when we knew things were coming down, and we put into a 3-step approach as to what it would be. The final step is what we're in now, which is a total lockdown, and with probably about 90% of our people working virtual, working from home, and our IT staff did a great job of putting this together so that we didn't miss a lick. You know, City Hall, you normally have maybe 44 people working in there. We've probably got about 3-4 working on the lower floor and about 3 working on the upper floor, well distanced apart from one another. All of our employees, regardless, they have to take their temperature on a daily basis, fill out a report form, and turn that in, so that we're pretty cognizant of where they're at with their health as we go forward too, because it's important that we keep them healthy as well, because without them, we can't give the services to our citizens that they need.
So, Mayor, Mayor Vernier was here yesterday. These days all kind of fold together, but I think it was yesterday. The dirt continues to fly in Shiloh and O'Fallon. And maybe you can go into permits really haven't slowed down, building hasn't slowed down. Talk about a couple of those projects that continue.
We, as you said, we continue to do our permits. We continue to do our building inspections. We've learned some new ways of doing it, some of it being virtual. But yes, we continue to have new developments occurring in O'Fallon. Matter of fact, in each of the last 2 virtual city council meetings, We've approved new facilities, a new 3-story office building on Route 50, and most recently was the infrastructure for a new apartment complex out on the east side of town, which will be about 200 apartments and about 4 or 5 office or different type of retail operations going in there. But plans continue. We continue to talk to others who are interested in coming into O'Fallon, and so business is as normal, except for some of our parks. We have observed them to make sure that everybody keeps compliance. Unfortunately, we've had to close down some of our baseball fields. We've had to close down some of our skate park, our basketball pavilions, playground equipment, because too close proximity or too many people gathering at one time. So, but we've tried to keep open the others so that people can actually get out, have some exercise, be able to walk, be able to go on the bike trails and so forth.
And you've spent a lot of money on bike trails and recreational opportunity, because tourism is a big part of what you do. Hotels are a big
No
part.
question, no question. Our parks, I think I would rate our parks among the best in Southern Illinois. We've done a lot of work with that. Our park staff constantly is monitoring. Matter of fact, they're monitoring our programs now to see, okay, which programs may we have to reduce or curtail because of just the timing or the proximity of people getting together, and which can we go forward with. And they're working with that on a daily basis.
So Mayor Kupsky from Fairview, your neighbor, and the Mayor of Shiloh, the mayor did have a furlough of employees that worked at his rec center, which is closed. But really beyond that, virtually no layoffs or furloughs. Shiloh's the same way, and you haven't had to lay off anyone either. You're continuing to plan for when COVID-19 ends.
We are, matter of fact, we are moving into the planning stages of where is it and how are we going to gradually get back to the new normal, whatever that new normal is going to be. We've already begun that planning. No, we have not had to lay any people off. Matter of fact, we are proceeding with all of our infrastructure work that we do on an annual basis. It's based off studies we did as to what roads need to be maintained, what water lines or sewer lines need to be replaced so that we don't have any major infrastructure breakdowns. So we continue with those on a regular basis, but I can't say enough for our public safety people. Our chief of police has led this. He is, from day one, when we knew things were coming down, we called in and had a meeting. We had that meeting with all of our schools, all of our churches, all of our retirement centers, large recplex programs, to fill them in on where we were at. And Eric took the lead on that because we wanted to give everybody as much information as they could have and as accurate of information, because we knew that eventually they were all going to have to make some tough decisions. And what's worse than to make tough decisions without having proper information to make those decisions on?
Well, that's a testament to your leadership, though.
Well,
that hasn't occurred everywhere, and that's to your credit. And to your credit is that you were able to negotiate how many contracts during the COVID epidemic?
During this period of time, our staff has continued to work with our bargaining units, and we have negotiated 4 new 3-year labor agreements that have been ratified by the City Council and have been ratified by the bargaining units.
They're hard enough to get negotiated and ratified. Even being able to sit across the table, that's a testament not only to having employees that trust you, but also the fact that your technology is pretty significant.
We're very blessed with a lot of good people working together in the same direction.
So how many of your total workforce is working virtually if they're not, in the parks or the streets?
That is correct. They are working virtual. Like I said, with our IT department being able to set everything up, we're able to handle everything through our computer systems. That's including bill paying and so forth. We've taken some extra precautions, of course, notifying people that their water was not going to be shut off, there wasn't going to be any fines or anything along those lines if they couldn't pay. And we're setting up plans for when we do get back to that new normal, how will they be able to make those payments and over what period of time be able to make. Plus, we've worked with our business community who has been terribly hit, and the employees of the business community on delaying some of their permits, delaying some of their licensing, decreasing some of those fees for them because they basically have not been able to operate, to try to work with them and make this as workable situation for them, because they're under really a big strain, as well as the staff that was working for them.
And I also understand from Memorial that the maternity ward, if that's what they still call it, has been moved to O'Fallon from Belleville.
Well, to Shiloh.
To Shiloh.
To Shiloh, yes, that is correct. And God bless all the new little babies that get born there, and they can look back and say, I'm a COVID baby.
Yes, well, let's hope we all can look back on this. And Herb Simmons?
Mayor, thanks for coming in. It's really an honor to have you come in. I know we talk every week on the phone, and I hope you found those conference calls that we do beneficial. And I can't say enough for your chiefs and the EMS people out there, your 911. Everybody's come together through this whole ordeal.
Well, Herb, that's a two-way street, because you and your staff, and I've mentioned to this before, and Mark, we can't thank you enough for the communications. You have done a great job of keeping all of us communicated with what's going on, the good, the bad, and the ugly, so that we can make proper decisions. And that is so very important. That's like when you came to us and said, Herb, can you get some signs out warning people about COVID and about keeping the distance? And you said, can you get 4 or 5 signs? Well, with the good cooperation of some of our businesses and all of our schools and what we had in the city, we've got 10 plus of those signs operating throughout the community right now.
And that's great. And one last question. As the mayor, we know everything runs downhill. So how is your citizens holding up? I mean, are you getting those calls at home? When's this thing going to end? You fielding some of those calls?
I left City Hall last night at 9:15. I had supper at 9:30. Okay.
That pretty well answers that call. We really appreciate all the hard work that you have done there, and we're going to get through this. I mean, as we said.
We are. We're going to get through this together, and we're going to come out on the better side.
Really appreciate it.
And you asked for those extended hours by creating the medical mile, that I think that's what you call it.
That is correct.
Between Shiloh and O'Fallon and the
That is
hospitals.
correct.
And that has come in very handy at this time.
Yes, it has.
Thank
Yes,
you.
it has.
That's great. Okay, real quick, more work that we did today. I'll tell you, as the chairman said, and the mayor, these days are running into one another, but we had a site visit, as the chairman said, opening up a new site. Hopefully that's going to be up and going here, and we'll be reporting on that in the next few days. Another site that we found out this afternoon is going to be opening up. Hopefully we'll have somebody in tomorrow to talk a little bit more about that. So as the chairman said, these testing sites is where it's going to be, and the people who want to get tested will be able to. We had 39 of the agencies pick up more PPE equipment today. We're glad to be able to get that out there to all of them. Before we go, as usual, I want you to stop and just remember those numbers that you heard Sam say. And when I said earlier, I hope the day is coming real soon that she walks in and says, Herb, we have no numbers to report today. And that day can't come soon enough, because statewide, 2,563 new positive cases, 28 new cases here in St. Clair County. Deaths across the state, 141. And out of that, 7 of those were right here in our county. That's, as I say all the time, that's somebody's loved one that passed away, probably by themselves, other than a nursing staff member that's not going to have the proper burial that we're used to having when we have a loved one that we send off. So when you're sitting around home tonight, just think about those numbers and just say a little extra thought and prayer for all of us that this comes to an end real quickly. Stay home, stay alive, and we'll be back tomorrow at 3:30 for the next briefing. We'll be back shortly with Cindy to translate this into our Spanish communities. Have a good evening.